Hi, everyone, and thank you so much for joining today. The topic of our presentation is cultural representation in healthcare. This topic is so important as the global population becomes more increasingly diverse. It's more important than ever to understand how culture shapes the different experiences of all different patients from their different walks of life. Next, we have the learning outcomes. So by the end of this presentation, you'll be able to understand the impact of culture on the treatment plans of patients dealing with chronic illnesses. We'll explore how the cultural beliefs, family roles, communication styles, and health practices influence patient decisions and engagement with their long-term care. Secondly, you'll be able to recognize the barriers faced by culled populations. These barriers may include language differences, mistrust in the healthcare systems, lack of cultural understanding from providers, and systematic inequities. Thirdly, you'll be able to identify strategies for cultural competent care. Cultural competence goes way beyond just awareness. It's about the clinical team adapting their approach to meet the diverse needs of all of their patients. And last but certainly not least, you'll be able to appreciate the role that the humanities play in healthcare. The humanities are not only just beautiful literature, art, and storytelling, but they also help healthcare professionals connect on a deeper level with their patients, fostering empathy and trust. So let's begin with what this topic is all about. Cultural representation in healthcare refers to incorporating patients' cultural values, beliefs, and traditions into their treatment programs, particularly for managing chronic illnesses. This concept, as highlighted by Arculio in 2013, recognizes that culture shapes how people understand illness, make health decisions, and respond to treatment. So, why does this matter? Standard Western medicine tends to follow a one-size-fits-all model, but according to Saha, Beach, and Cooper in 2019, the model often neglects cultural perspectives, which leads to miscommunication, mistrust between patients and their providers, and ultimately poor adherence to treatment. If a patient feels as though they don't feel understood or respected, they are less likely to follow through with medical advice from any provider. The challenge becomes even greater for culturally and linguistic diverse, also known as called communities. As Lambert in 2021 explains, these groups face multiple barriers in healthcare, including language differences, low healthcare literacy, and confusion about the foreign healthcare and confusion on how foreign healthcare systems work. These challenges can delay care or lead to misunderstandings that seriously affect health outcomes. The real-world impact of ignoring culture in healthcare is significant. SIPTA in 2024 found that a lack of cultural awareness can directly contribute to poor health outcomes, especially in populations with strong religious or traditional beliefs. When care clashes with the patient's values, it can lead to fear, rejection of treatment, or avoidance of medical services altogether. So, is there a solution? There definitely is. So, the solution is we need a more culturally responsive healthcare system. This starts with cultural competency training for all healthcare professionals, no matter their role in how big or how little their role is in a patient's care, so they can communicate more effectively and respectfully with diverse patients. Second, using translators can definitely help break down language barriers. And third, narrative medicine, as introduced by Sharon in 2001, encourages clinicians to listen to their patients' stories, building empathy and trust. Shaheen in 2019 also shows that these approaches can improve both care quality and patient satisfaction.
Okay, so for our presentation, Cultural Representation in Healthcare, after completing an analysis paper, we discovered that cultural competence is essential in healthcare. Ah, shit. Okay. So for presentation, cultural representation, in healthcare, after completing the analysis paper, we discovered that cultural competence is essential in healthcare when improving patient outcomes suffering from chronic illnesses. Or evidence suggests that healthcare systems that acknowledge and respect different cultural beliefs lead to better overall communication and treatment. The research included in our research in our analysis papers, such as the Health Policy Institute, emphasize that healthcare systems that are culture aware reduce racial disparities and foster a more inclusive healthcare operations. Understanding patients' cultural beliefs and values not only improves a patient-provider relationship, but also improves results in care that cater towards patient beliefs, overall improving the quality of care, accessibility of care, while incorporating diverse perspectives into care. Furthermore, our research highlights that cultural sensitivity and effective communication in a patient-provider relationship is essential they address any challenges that might arise through conflicting personal or cultural beliefs. Our resources support the idea that understanding a patient's basic knowledge of illnesses and their perception of chronic illnesses can lead to a more successful health outcomes and better treatment plans. As stated earlier, these facts suggest how imperative it is to incorporate cultural awareness into the medical field and medical practice, ensuring that healthcare professionals receive the necessary training to navigate through complex situations. All in all, to all in all, we try to emphasize the significance of respecting cultural differences in our modern world to reduce racial disparities in the healthcare system and enhance health outcomes for patients with diverse backgrounds suffering from chronic illnesses. So, for practical implications on how to actually integrate our findings into the healthcare field and how different healthcare situations can use this knowledge to make better personalized care treatment plans for their patients and for the future. We include strategies or training methods to improve cultural competence for healthcare professionals to ensure they understand and respect diverse cultures. Additionally, healthcare systems can adopt models that are tailored towards various cultural beliefs where treatment plans for chronic illnesses are constructed with the patient's cultural values and mindset with the with the patient's cultural values and mindset in mind, thus improving the effectiveness of healthcare and cultural sensitivity. So we basically say that healthcare systems can like adopt different types of plans to make treatment plans for for diverse people more inclusive in order to like and understand their mindset of how of their basic knowledge of chronic illnesses and how we could implement their knowledge as well as our modern technology to a more effective treatment plan. Furthermore, incorporating humanities in the medical field, such as narrative medicine or art-based initiatives, humanities can enhance healthcare professionals' communications and communication skills. Can enhance healthcare professionals' communication skills. Moreover, encouraging narrative-based care through patient storytelling while incorporating cultural competence into care can strengthen patient-provider relationships, build trust and rapport, and lead to better overall health outcomes by addressing cultural context for patients suffering from chronic illnesses. Like I stated earlier. Another practical implication to bring our findings to healthcare would be to improve health literacy and design education system with materials that is culturally relevant to modern day and accessible to different populations of diverse background. Healthcare institutions could implement bilingual speakers or multi-language resources to ensure that both patient and provider fully understand any conditions or treatments they're discussing. So, like, if any patient doesn't speak English that well, a health institution could have a interpreter to help them understand of what they're receiving, what type of care they need, or how the interpreter could give the professional a basic understanding of what the patient believes in their culture of how to combat certain illnesses. Additionally, adopting a more personalized approach towards chronic illness management would prove beneficial because it eliminates any conflict of interest between the patient and provider, leading to better health outcomes such as considering the traditional or alternative methods that different patients values from diverse cultures. Implementing these strategies in practice in various healthcare institutions would require ongoing efforts such as policy changing policies, professional development, or collaborating with the community to address any cultural disparities that affect health outcomes, all to promote a more inclusive healthcare system.
So I focused on what cultural competency would mean for how healthcare is practiced. My name is Alexis. Cultural beliefs influence patients' perspectives on sickness and treatment, which continue to grow more diverse and globalized. Individuals from culturally and linguistically diverse backgrounds often experience significant barriers to assessing and understanding healthcare. Cultural misunderstandings can affect the care of a patient, resulting in different outcomes. It would improve how healthcare is practiced due to language barriers being broken, being ethically aware of patients' wants, beliefs, and overall patient outcomes. Basically, overall, for this, healthcare would be practiced more efficiently, providing ways to understand how different cultures, beliefs, and wants are within certain healthcare and how to meet the patient's needs. How would this mean for, or what would this mean for how healthcare professionals are educated and trained? Research has indicated that incorporating cultural values into treating long-term illnesses can enhance patient results greatly. A research study involving a Mexican mother's managing childhood asthma, medical professionals who were aware of and considerate of her cultural values were better equipped to develop focused asthma treatment strategies for her. Professionals claim that healthcare providers have to gain insight into cultural competency and illness perception based on different cultures to increase loyalty to the regimens for patients with chronic illness. Significant illness perception, beliefs, and emotional response can either positively or negatively affect a patient's willingness to undergo treatments. Understanding these factors can help healthcare professionals develop patient-specific treatments to improve chronic conditions. So overall, healthcare professionals will be educated and trained more on how different cultures' beliefs work within healthcare. They would be provided insight on different ways to come up with different strategies to help them with treatments. They would also be helpful with, they would have to learn different language barriers and how to provide care and understanding for that. It would provide just better ways overall for the patient to have better care from the health professional. And how would this improve healthcare? Healthcare would be benefited for a majority of reasons, including better treatment, understanding emotional and physical support, and improving their health outcomes. Understanding the patient is important for language barriers if they have cultural beliefs that may not follow protocol, and figuring out different options if it may not be what the patient wants or believes in. Being emotionally and physically supportive for the patient is important to consider, making sure that they have the best healthcare experience while they're there. Improving outcomes will come from all these things when the patient feels heard and understood by health professionals, therefore improving their quality of life. Overall, healthcare would just be benefited for the professionals and for the patients. Healthcare professionals will understand more how to deal with those who have cultural beliefs and different wants and needs, and the patient will feel supported, and they will most likely do their treatments more, which improves their quality of life better. And just overall, healthcare will be benefited for both professional and patient outcomes.
Hi, I'm Isabella. I took care of the reference portion of our presentation project. We have, hold on, 2, 3 reference pages, and all of our references are very helpful in allowing us to understand cultural representation in healthcare and the importance of it. We thank you for a good semester, and we really hope that you enjoyed our presentation. It was really interesting learning about new things within healthcare and learning the huge impact the humanities can have, not just on healthcare, but a whole bunch of other perspectives in life. So it was nice to learn about that. Again, thank you for a good semester.